Hi, everyone. I'm Jeralise Diaz with the Record Journal. We're here with our weekly segment, Ask the Expert, in partnership with Hartford Healthcare's MidState Medical Center, Community Health Center, the United Way of Meriden and Wallingford, the Spanish Community of Wallingford, the State of Connecticut, and the Connecticut Department of Public Health. We'll talk about various aspects of the vaccine rollout and have a medical expert answer a weekly question. Today, I'm joined by Lea Crown, Meriden Director of Health and Human Services. This week's question is, if I've been fully vaccinated and exposed to someone with COVID-19, do I still need to quarantine?
Great. Thank you for having me. This is a wonderful service that you're doing for our community. So the good news is no. If someone is fully vaccinated and has an exposure to someone who subsequently tests positive for COVID-19, they do not need to quarantine as long as that person remains asymptomatic. And asymptomatic means they show no signs or symptoms of COVID-19. So there's a lot of public health terms in that answer to that question. So the first thing I'd like to do is just define, what does quarantine mean? We tend to use quarantine and isolation interchangeably, but those two terms actually mean two different things. So isolation is for the person with COVID-19. We want to isolate the person with a diagnosed disease or infectious disease, in this case, COVID, from others, so that way they don't spread the disease to others. Quarantine is a term that public health uses to keep someone who may have been exposed to COVID-19 away from others. So quarantine helps prevent spread of disease that can occur before a person knows they are sick, or if they are infected with a virus without symptoms. So because vaccination is important in the prevention of the spread, in general, people are considered fully vaccinated if it has been at least 2 weeks since their second dose in a 2-dose series. So if a person chooses to get Pfizer or Moderna, 14 days or 2 weeks after that last dose, they're considered fully vaccinated, or 2 weeks after a single dose vaccine, such as the Johnson & Johnson vaccine. And then there's the term exposure. Well, what does that mean? So someone is considered exposed to someone with COVID-19 if they were within 6 feet of someone for a total of 15 cumulative minutes over a 24-hour period during that person's infectious period. So someone is considered infectious with COVID-19 48 hours or 2 days before an asymptomatic positive test. So that means, you know what, I didn't have any symptoms, so I decided to go get tested, maybe because of an exposure or for my job, for travel requirements, and oh, I came up positive. That's what we consider an asymptomatic positive test result. Or someone is considered exposed if they were around the person that subsequently tested positive for COVID 48 hours prior to that person starting to show symptoms. So we call this now being a close contact. So through contact tracing, when we call a person who's diagnosed with COVID, we ask them, who have you been around in that time frame? So that way we can then reach out to those individuals without disclosing who the positive person was to inform them about quarantine. So if this close contact is unvaccinated, we recommend that they stay home and monitor their health for 14 days after their last day of known exposure to that person who tested positive for COVID. And your local health department can discuss options for reducing the time of quarantine if 14 days is going to be a financial or an economic social burden on that person. So during our continued contact tracing efforts, we ask all of their close contacts now about vaccination status. So that's one of the questions that we added into our interview. So we ask them, have you been vaccinated? They tell us yes. We go through a timeline. If it's been more than the 14 days, we say, hey, guess what? Great job getting vaccinated. Even though you were exposed and you're not feeling ill, you do not need to quarantine, but we just want you to pay a little bit more attention to your health. So if you do start to show signs and symptoms, we want you to isolate, which means remove yourself, go get a test, and then wait at home until you get your test results. So certainly not having to quarantine is a bonus for getting the vaccine, right? Instead of reducing your risk of getting COVID, possibly spreading it to others, being able to return to regular activities post-pandemic, now not having to quarantine is a big sigh of relief for people, especially if they don't have the personal time off, let's say at work, or if childcare is going to be a struggle. It really is a benefit. With that, I guess I'll turn it back over to Jeralise.
Thank you, Lea Crown, for joining us today, and thank you all for watching. Tune in next week for our next Ask the Expert. If you have a question you would like answered, leave it in the comments and we'll add it to our list. Thank you again to our partners for making this possible: Hartford Healthcare's MidState Medical Center, Community Health Center, the United Way of Meriden and Wallingford, the Spanish Community of Wallingford, the State of Connecticut, and the Connecticut Department of Public Health.